This is just but part of the reason why when they graduate, sometimes their expectations are not met. And they've now turned the hospital, unfortunately, as a battleground. And each one wants to control as much power as possible.
Now you're talking about the medical doctors and the support staff, like
they don't even want to be called support staff.
Well,
but
like
that's what they are.
But that's what they are, like
the
physiotherapists, the pharmacists, and the nurses, and so forth, right? So that we can clear, so people who don't know the background to this story would know exactly what we're talking about. That's why I'm bringing that up.
Yes, in a hospital setting, mark my words.
Yes, hospital setting.
In a hospital setting, the hospital is the mentor of the doctor. There's no doubt about that. Whereas the doctor working for companies like Shell or NPC, they are support staff there. Because the primary purpose of NPC is not to treat sick people. The primary purpose of NPC is to ensure exploration goes on and to exploit this natural resource, crude oil and gas, natural gas, for the benefit of the country. So their doctors there are support staff. Pharmacists there are support staff. When you go to a drug manufacturing company, there are doctors who work there, but they actually called medical advisors. They are support staff under that circumstance. They are not the men. If you go to a gym, a gymnasium, sometimes you have doctors working there to examine people before they start, to be sure that it's safe for you. There, the physiotherapist holds forth. There, any other person, including doctors, are support staff to the physiotherapist. So everybody has a place where he primarily is the primary provider of services. In a hospital, it is the doctor, because ordinarily, each one of us, including the Honorable Minister of Health, will all say, let me go and see my doctor. Everyone says that. Nobody says go and see any other place. So obviously, the hospital has the doctor as the main thing, and every other person, whether we actually like it or not, I'm sure people will say, the minister, you are causing more problem. But if the truth must be told, everybody there is to help that doctor achieve with the patient what the patient went to the hospital for.
As you're saying, everybody is important in the system. So why is there this rivalry?
The rivalry comes because people don't want to tell themselves the truth. Let's take, for instance, the doctors. The doctors have to realize that there's no way they can give optimum care to any patient without the support of others. It's just not possible. It's impossible. So the doctor has to be humble to accept that, yes, indeed, all the other health professionals are there to assist him and assist the patient to achieve the purpose for which the patient came to the hospital in the first instance. The doctor has to ensure that all the other professionals are well respected. They are professionals in their own right. They were all in class in secondary school, and people decided what they wanted to read. So they need to respect the other professionals, that they are very important, and give them their due regards, and also respect them in terms of listening to them in terms of professional advice. They do need professional advice from the others, whether be they nurses, be they pharmacists, medical laboratory science, physiotherapists, and all that. They need to do that. They also need to understand the concept of teamwork. They need to carry others along as they manage the patient in the spirit of teamwork. Once they did that, they shouldn't have any problem. For the others, all they need to understand is that it's just in the hospital setting. They are very important. In some instances, they are actually the prime givers. But in this instance where a patient is before a doctor, the doctor now assumes a bigger role than they. So once you understand that, it doesn't demean you. It doesn't mean you are inferior by any way. Many of the people who are today in those fields were as good, if not better than others who went to read medicine. So just purely a matter of choice. Some of us could have read other things.
The NMA wants government to appoint a Surgeon General of the Federation, but the Professionals and Joint Health Sector Union is demanding a halt to that appointment, saying that the concept remains both unconstitutional and unlawful. Where do you stand on this debate?
Well, this is, Surgeon General is something we have in the United States of America. But some of the role of the Surgeon General in the United States of America is performed in some other countries by people who are called Chief Medical Officer. For instance, in the UK, such a person is called Chief Medical Officer. In a country like Canada, I think they've chosen the title Chief Medical Advisor. But there are certain roles for for which people in such positions ought to perform. You know that a minister is a political appointee. A minister doesn't even have to be a medical doctor, to be Minister of Health. He's supposed to be a politician who understands the mandate of that ministry in which the president has asked him to go to, who understands also the manifesto of Mr. President and the party to which Mr. President belongs, and who also is able to be able to obey the president and listen carefully to president when the president says, this is what I want to achieve, this is what I promised Nigerians in that area. So simply, it's just a broadly educated person who is a good politician, who is a good manager of men, women, and resources and the rest, a good administrator. That's what a minister is all about. But I think why in Nigeria we've always found it difficult to decide whether the Minister of Health ought to be a medical doctor or just any politician is because something is missing. And I think what is missing, by whatever name called, either chief medical officer, chief medical advisor, or Surgeon General as the United States of America has, that is missing. You need a professional who is completely removed from politics to do certain jobs. Take, for instance, some of the provisions of our Constitution, that a president, that a governor has to remain in good health. And that, in fact, one of the grounds for impeachment is that either the president or the governor or even deputy governor or the vice president are found to be in a mental state that cannot allow them to perform their jobs, or have become so ill that they can no longer perform their job. Now, who is to decide that? It's a problem. If you ask the Minister of Health, the President Minister...
Who might be a politician.
The President Minister here is a politician, he's a member of PDP. He will find it difficult to want to say, he first want to hold a meeting with the PDP on it. That is not professional enough. If you say, okay, give it to the CMD is an appointee of the president. It's a bit weak. And the CMDs at the state level also appointees of the respective governors. So it's a bit weak. They are afraid that if they say something that may not be palatable, they will be removed from their office. So NMA now was saying, why don't we go the way we have in the United States, where Mr. President nominates, Congress approves. So it becomes like some other positions in this that are constitutionally protected, where the president approves and the Senate approves. And even when to remove such people, sometimes you may require the National Assembly to also consent before you can remove. So that is one argument, okay, that is going on. Now, the other argument is that people are saying, no, they don't need a Surgeon General because it's like making the doctor totally in charge of the health sector. And it's not true. We can also have other professionals have their own authority general, as it were, if they make a case for it. Now, whether it is constitutional or it's legal or it could come by Mr. President, in Britain, they don't even have a written constitution. Why do we make so much noise about constitution? It all depends on to what degree you want to make the team powerful. Now, the whole idea of trying to make something to have a law is so that it doesn't depend on a particular president or governor for the team to continue if it's in the interest of the country. You want it such a way that if a sitting president or a sitting governor wants to change it, he has to go back to the legislature, who are also representatives of the people in the wider sense. Not that the president or governor are not. Remember, the president has the whole country as his constituency, so it's also in some way the representative of the people. But there you also have other representatives of the people, so it's wider in the National Assembly, for instance, or state houses of assembly. The president can even today decide to make it an administrative position and purely make it and just appoint a Surgeon General purely as an administrative position. Do you get my point? Mm-hmm. Just like the head of service appoints directors in the ministries. The only difference is that it may be something good, but how sustainable is it if the president leaves office? So that is why sometimes it's good to have it in the law. Now, the idea of putting it constitutional is even to make it more difficult for anyone to come in on board and cancel the position. So it doesn't really matter. It can be done as an administrative thing. It can be done through a law, in which case you still need the National Assembly. It can be done as a constitutional provision, in which case you need, beyond the National Assembly, you also need the buy-in of even state houses or assembly.
We will take a break now. I'll return in a short while with the Honorable Minister of Health, and I ask you that you please join us again. Come back. When can Nigerians expect to get universal health coverage when it is said that less than 5% of the population is currently covered? If that is...
Well, by the data we're given the last time, which I sent to the president, the most is that we're about 8% of Nigerians are enjoying one form of health insurance under that. We're not only talking about the ones under the national health insurance. Mind you, there are Nigerians who are under insurance bought for them by their employers, but private health insurance. There are others who are doing the community-based health insurance, some under the national health insurance scheme, some not outside the national health insurance scheme. But the aggregate of Nigerians who are enjoying some form of health insurance is about 8%. Now, that is a far cry. Now, when we are setting our target for 2015, Mr. President said, can we make it even 30%? That is a tall order, no doubt, but that is something we should be able to work towards. But what even happens with the remaining 70%?
What needs to happen to achieve that 30%
now,
to start
what needs to happen is that we must make health insurance mandatory. We must make it compulsory, like in most of the other countries. And the president has accepted to host a presidential summit on what we call universal health coverage. Now, universal health insurance is just a part of universal health coverage. But we want to use that opportunity to get the buy-in of everyone, including the legislature, including the state governments and their legislatures, including those who provide the service, government, non-government actors, whether you are for profit or not for profit. So it will include even the faith-based organizations who you know actually own many of these health facilities in the country. We are going to invite everyone, going to invite the organized private sector. We're going to invite banks, the World Bank, World Health Organization, everybody that is a stakeholder, even the media, because they have an opinion on it. They will help us mobilize if they accept, have a buy-in into it.
How can we stop the outflow of foreign currency by Nigerians who go abroad for everything from medical checkups to major surgeries?
The first is to stop Nigerians from loving everything that is foreign. Many people make their clothes outside the country. Not that we don't have tailors here. Many people dry clean their clothes outside the country. Is it that we don't have dry cleaners in Nigeria? Many people will buy all sorts of things from abroad. As you know, we have a love for everything foreign. For me, my understanding is that what is not available in your country, you should get from elsewhere in the world, which will be free. Don't get me wrong. But certainly if something is available in your country, use it. So it's not only healthcare. You know that people keep attacking us. But when I challenge them, I said, if we go sector by sector, you find that maybe other sectors are actually enjoying foreign goods more than the health sector. So the first thing is, how do we win ourselves from colonial mentality? So that's number one. If we solve it, we'll go somewhere. The second one is to build confidence, because I believe also it's also important for us to rebuild the confidence. I think at a certain point, people lost confidence, even amongst the doctors. You see doctors who not even ask their colleagues. Before you know it, they're already referring patients. And so many patients have died outside this country. Believe you me. So many, I'm so ashamed. So many, because they are not well selected. And even for conditions that people outside cannot treat better than those of us inside. Because there are some conditions that are better treated here because we understand the disease better than going outside. But everybody is an expert outside, whether you're a technician or not.
My final question, why is Nigeria still discussing polio when the disease is all but eliminated in the rest of the world?
Well, that is why we are so embarrassed about it. But then, we have challenges we cannot run away from in Nigeria. But the fact that Mr. President personally is driving the process today, and we all with him grappling with the problem, is something that has made us a country. Unfortunately, we have not eradicated it, but it's a country people are saying you can learn from Nigeria. Everyone is on board now, religious leaders, traditional rulers, because the reasons why we're not achieving it goes beyond just what we're doing in the health sector. So we needed the buy-in of everyone. But it's paying off. I think that's what is important. It's paying off. Now, we only have type 1 to contend with. It's too early to make noise. Even as I say this, I say with so much trepidation. But I'm proud to say that at least in the last 3 months, no single case. Not there yet. Too early to say hallelujah, but it has never been this in the last few years. So type 3, no more. For the first time in the history of Nigeria. Type 3 white polio virus, since more than 1 year now, we've not had a single one. You won't believe it, that's the first time. That's also the first time, at least in some years now, 3 months will pass without a single case. We're doing well in that regard. Compared to 2012, 2013 was okay. We reduced it by 50%. Something to be happy about. Then the immunization coverage is much better. The quality of immunization is good. Now, we know the local governments that are drawing us back. It's not actually states as it were that are drawing us back. Because in each of those states, it's not all the local governments. Today, we've mapped out the specific local governments that are drawing us back. So we're better focused. We're doing a lot. We're even, bullying everyone along the way. But what we are doing simply is to get it right. Now, 2 issues are drawing us back. In the case of Kano, we've identified the issue. A bit of security challenges initially. Remember, that's where vaccinators were killed. Vaccinators were killed. But the state government, but the governor rose to the challenge and said, no, we're not afraid. The vaccinator said, Honorable Minister, the only thing that will serve the memory of our departed colleagues is to end polio. So we'll continue. But of course, we had that responsibility as government to provide security for them. So Kano is no more much of security now, as much as some of those local governments, they were weak in terms of our teams there. Remember, we're doing this with the local governments. So now we're working with the local governments to replace some of the personnel there. Now, Borno and Yobe were basically because of security challenges. Again, we're working with the security agencies now. We're working with the office of the NSA. We hope we'll be able to have safe corridors to be able to get our people well. But we're making effort. At least we have access to all the local governments in Yobe State.
Honorable Minister of Health, Professor Onyebuchi Chukwu, thank you for your time.
Thank you.
And we thank you for watching. Please join us again next week when View from the Top returns. Do have a good afternoon.